Good morning, good afternoon, and good evening to anybody depending on when they are watching this. My name is Garry Randhawa, and today I'll be presenting Salmonella enterica. This is part of my class for medical microbiology with Dr. Trisha Van Laar, and we will be discussing Salmonella enterica. Taking a look at our patient, which is a 27-year-old male with severe abdominal pain. He has watery diarrhea, lots of vomiting, and has 101 degrees fever. This man had recently returned from a family trip from Bangladesh and Nepal. He was there for a village celebration, and what ended up happening was he ate undercooked roasted chicken, essentially that was pink on the inside, and that is where he ended up getting salmonella. Taking a look at the introduction, I want to break down what Salmonella is. Salmonella enterica is the proper name, but you may hear it people saying short Salmonella. Salmonella is a gram-negative rod-shaped bacterium pathogen that can survive inside the human immune cells. It pretty much causes illness ranging basically from mild stomach upset to severe diseases like typhoid fever. Moving forward, Salmonella is a common worldwide. It's pretty common worldwide, especially in South Asia, China, and South Korea. It can spread pretty easily and is honestly linked to poor hygiene, contaminated water, and undercooked poultry. Meaning, this could be chicken, some kind of fish, even perhaps, and the list goes on and on. Moving forward, there was a stool test confirmed for salmonella for this patient, and it confirmed that the Salmonella enterica was there with a gene called CTXM15, and this means it is actually resistant to ceftriaxone, which was given first. So unfortunately, it didn't work since it was a gene that was resistant to this, which was called ceftrioxane. Then we switched to azithromycin and IV fluids, and from there, the patient improved within the first 48 hours, which was good news. Moving forward, it is highly common in South Asia, as mentioned before, and South Korea. Something that is talked about a lot when it comes to salmonella is that a lot of people overlook this, but people don't really talk about and have this big approach of why sanitation is so important. Because poor sanitation and lack of clean water increases the spread. Improper food storage, crowded poultry farms, and this allows the rapid animal to animal transmission, which is what we do not want. The infection, other from undercooked meat or meat juices contaminating other food, is exactly why it is very scary because when it comes to undercooked food, we quickly start eating, but we don't notice until sometimes we've already eaten a bite, and sometimes it can just take a little bit of food to cause this, which is why it is very scary. Moving forward, taking a look at the microbiological context, Salmonella enterica is a rod-shaped gram-negative bacterium. It injects proteins into the host cells during an attack. The CTXM15 gene that we had mentioned previously was detected in the case, making it resistant to ceftriaxone overall. Taking a look at the clinical implications, the patient was given ceftriaxone, but it did not work because of the CTXM15 resistance gene that we have talked about. Then the patient was then treated with azithromycin and IV fluids and improved, as mentioned before, overall within the first 48 hours. It was resistant to azithromycin and was also increasing, which is something you had to take a good look at. And the patients must finish the full course of the antibiotics so the bacteria does not come back and start mutating and get stronger. Moving forward, we have the how this works. Salmonella basically enters through the contaminated food or the water, starts to invade intestines, then can enter the bloodstream, which is when things go really bad, is when it enters the bloodstream. Basically hides inside the immune cells and multiplies undetected. CTXM15 gene causes ceftriaxone, which is a common thing to be resistance because how powerful salmonella can be. And with this gene, it gets tricky. Moving forward, we have this talk about the CTXM15 gene linked to the ceftriaxone resistance. Overuse of antibiotics in livestock farming drives resistance. So that is a big part of this, which is why azithromycin resistance is rising globally because since we can't sometimes use ceftriaxone because of this gene. So over time, salmonella is starting to adapt to azithromycin, which is not what we want, and it's getting scarier. Moving forward, we have the outbreak that happened in Chile. In 2024, the outbreak in Chile is basically contaminated chicken, which is why it basically happened. Genetic typing traced infections to one bacterial clone, showed the importance of tracing sources and controlling contamination in the food because this outbreak was huge and affected a lot of people. So when it comes to the treatments, many strains no longer respond to older antibiotics. Completing treatment prevents relapse and even stronger resistance. So it's very important to follow your full cycle. Resistance testing is critical before choosing antibiotics as well. To prevent this, some good things to look out for is cook poultry and eggs thoroughly, wash hands and utensils after handling the raw meat, use clean water for drinking and cooking, educate children on safe food handling, and inspect the farms and meat factories regularly for sanitation. Something else we can implement into the public health is we need to talk about how it can be very severe in children and people that are immunocompromised because they automatically have a weaker immune system, meaning they can get hit with this a little harder and easier. AIDS and salmonella easily spreads through the food supply. Prevention is more cost effective than outbreak control overall. Sanitation, education, and monitoring can reduce the global cases overall, which is huge. Taking a look at our first question, which virulence factor allows Salmonella enterica ultimately to survive and replicate inside the human immune cells like macrophages? The answer would be C, which was type 3 secretion system. Moving forward, why did the patient in the case not respond to ceftriaxone treatment? And the answer for this was A. The strain was resistant due to the CTX-MG15 gene, which is why it did not work. Moving forward, which region did the patient travel to that raised suspicion for antibiotic-resistant Salmonella enterica? It was D, South Asia, because they were in Nepal. What is one key prevention method for reducing the spread of Salmonella infections? The answer is C, practicing proper food hygiene and good cooking. And taking a look at the next question, what makes salmonella increasingly difficult to treat on a global scale? It's C, resistance to multiple antibodies due to the overuse in livestock. Here is the works cited. And thank you so much for your time. In the end, we realized how important it is to stay clean, and we need to realize how sanitation can be such a big factor in treating salmonella and just preventing it as well. So thank you so much for your guys' time, and I wish you guys a great rest of your day.